Good afternoon, everyone. I am Ann Wong with the Illinois Chapter American Academy of Pediatrics, and I thank you for joining us for today's webinar, Increasing Vaccine Coverage Levels by Maximizing the Eye Care Registry. Today we are joined by Bridget Ahrens and Matt Swenny. Before we begin, I would just like to go over a few housekeeping items. This webinar is being sponsored for continuing education by the Illinois Chapter American Academy of Pediatrics, who is accredited by the Illinois State Medical Society to provide continuing education for physicians. The Illinois Chapter American Academy of Pediatrics designates this live activity for a maximum of 1 AMA PRA Category 1 credits. Participant phone lines are muted. This webinar is being recorded. Everyone will receive a copy of the PowerPoint slides, a link to complete the webinar evaluation, and a link to the recording of the webinar by the end of business day. If you have any questions for our speaker during the presentation, please enter them into the question box on your control panel for the webinar located on the right-hand side of your screen. Your question will be answered at the end of the presentation. So our first speaker today is Bridget Ahrens. She has been the Vermont Immunization Registry Manager since 2004 and currently leads a team of 3 analysts and support professionals at the Vermont Department of Public Health. She works closely with the immunization program at the Vermont Department of Health to assess and improve vaccine coverage in medical practices throughout the state. She has a Master's of Public Health degree from the University of California at Berkeley. Please join me in welcoming Bridget.
The broadcast is now starting. All attendees are in listen-only mode.
Okay, Bridget, I'm going to give you control of the screen now, and you're going to be able to present.
Okay. Are we good to go?
Yes.
Hello. I'm going to talk with you today about how we're using an immunization registry to provide
your presentation right now.
What?
We can't see your presentation.
I see. Hang on. Can you see it now?
Yes.
Okay. We're going to talk today about using an immunization registry to provide quarterly HPV vaccination coverage feedbacks to providers in Vermont. We're basically talking about being cheerleaders for vaccine coverage by using an immunization registry. My disclosure slide, I have no relevant financial relationships with manufacturers of any commercial products, and I don't intend to discuss any unapproved or investigative uses of a commercial product in this presentation. So, there is an old saying, perhaps you've heard it before, if you build it, they will come. You knew I was talking about immunization registries, right? Or immunization information systems. Those two terms are used interchangeably. In Vermont, we have what we call an immunization registry, and our system has been live since 2004. It's a birth-to-death system, and so we're connected with vital records. The minute a patient is born in Vermont, they're entered into the immunization registry, and upon the minute someone begins a death certificate for a person, they become invisible in the system. We've backloaded our births and many of our deaths, so our system is quite complete. We have mandated reporting in our state, so by law all providers who give an immunization in anywhere are technically required to report it to the immunization registry. So at this point, nearly all the hospitals and primary care providers who serve children are reporting, most of them through HL7 messaging. Adult primary care are coming on more and more, and we're beginning to get pharmacies as well. We do have some gaps with records that predate like 1995. It's sometimes hard to get those, but generally speaking, we've got really good information in our system. But the only reason for having a registry in the first place is to be able to use it for a purpose. And one of our biggest tasks right now is figuring out how to get people to actually use the data that's in our system. We've got them to report, but now we want them to do something with it. What we've found is that data use doesn't come naturally, and especially in a world where sometimes even the reporting is happening automatically through an EHR. Getting providers to be aware of and to use the data in the immunization registry has been a bit of a challenge. But what we've found, and I'll show in this presentation, is that promotion does work, and perspective works. When providers figure out what they have within immunization registry, they're excited about it, and they'll use it to improve vaccine delivery in their practice. So our goal is to give providers what they need. So beginning in January of 2015, we did an initiative to do a quarterly mailing to all Vermont providers. Our initial focus was to look in great detail on HPV. We wanted to provide providers with initiation rates and completion rates, and we wanted to compare each medical practice directly to the state rates. Now, we're not saying that what we're doing is responsible for the growing, the increasing rates of HPV in Vermont, but what we are saying is that we're a really important tool for measuring that growth. So this is an example of the quarterly report that we sent out to all providers. This report is for a practice called fictional family medicine. And if you look at the column with the shading here, what we did is for each practice, we provided them with the percentage of patients in their practice who were in the age group that we looked at, the 13 through 17-year-olds, what percent had initiated the HPV series by getting at least one dose. And at Fictional Family Medicine, who has 760 patients in that group, 66.7% of them had initiated the series. Statewide, our rate was 57.3%. So this practice is doing somewhat better than the state. We also provided them with a rate for at least 2 doses of HPV, and finally their series completion rates, 39.1% for this practice compared to 36.1% for the state. We also gave them the breakdown of females and males because, of course, with HPV you had an HPV vaccine license for before you did for males, so there was a little bit of catch-up involved. So we began this project, the earliest assessment period was Q4 of 2014, and we thought that it would be really good to take a look at the state rates over that period of time. So here's the HPV series initiation rates for Vermont patients who had received at least 1 dose of HPV. At baseline, we had 47.7% who had received 1 dose. And by the most recent quarter, we've continued this project. We're now up to 57.3%. So we're really seeing the growth, and we're seeing it in females and in males as well. This is the initiation information shown in a line graph. Now, we want to keep in mind that the goal here is 80%, so we're not there yet, but what we are seeing is progress. We also plotted out the HPV series completion rate at the state level for the Vermont patients 13 through 17 years. And in this case, we began with a rate of 26.6% of the patients were completely up to date with 3 doses of HPV. And the most recent quarter that we handed out was they were up to 36.1%. Again, we put the same information into a line graph, and what we're trying to do is find what's the most helpful way of displaying some of this information. We use the line graph and people like that, but we've also used GIS mapping because with this we can show the breakdown in our state about how are we doing with HPV coverage by actual county. We have 14 counties in Vermont. So here we have the percentage of adolescents aged 13 through 17 with at least 3 doses of HPV vaccine back in July of 2015. You'll see that we have a belt across the center here of Vermont where the rates were higher. And this is actually where the largest center of the population is. Our cities tend to have a little higher rates than some of the more outlying regions like Essex County and Franklin County. A year later, in July of 2016, we're seeing progress everywhere. Again, we're still seeing this pattern where the cities are higher. We also gave providers the ability to see this in a line graph, and we found that many people actually preferred looking at a bar graph over a GIS map. We're lucky in Vermont we only have 14 counties, so that's something that's easy to do, but you can quickly pinpoint progress and who's doing well and who's kind of lagging. Now, as HPV rates continued to increase, we wanted to shift our focus to series initiation among children ages 11 and 12. With yesterday's announcement from the ACIP group, we expect to modify our plans to provide some additional guidance to providers around the changing definition of HPV series completion. So, for instance, we may choose to provide vaccine coverage reports showing series completion rates that include series completion based on the new rule that says that only 2 doses are needed if the first dose occurred prior to age 15, as well as the 1, 2, and 3 dose numbers. We really need to focus on this 11 to 12-year-old group in Vermont because, as you'll see, we looked at this information, but we actually didn't send it to providers. But you can see we're having some trouble with getting the series started at an early enough time. Finally, the Vermont Immunization Registry has some tools inside of it that lets the provider actually take charge of their own practice information and use it. So this is an example of one of the tools in our registry. It's the Not Up to Date report that actually tells the provider who it is that's not up to date. Not just you will have 30% coverage, but who are the people in that the 70% that you haven't reached. So our Not Up to Date report allows practices to either print a line list of each of the patients who are not up to date for a particular series, or they can also print mailing labels to send a reminder recall postcard. Insight is helpful. Providers see one patient at a time, and immunization registries give the providers the perspective to see the big picture of how they're protecting their patients by immunizing them against HPV or whatever series. So there's another old saying, if it's useful, they'll use it. I don't think it was Kevin Costner who said that. And here's my contact information. Thank you very much for your attention.
Okay, thank you so much for that presentation, Bridget. We are now going to switch over to Matthew Swenny from IDPH, who will be our next presenter. Matthew J. Swenny graduated from Culver Stockton College with a Bachelor's of Science in Psychology, the University of Illinois with a Master of Arts in Psychology, and Quincy University with a Master's of Arts in Educational Administration. Matthew has his licensed clinical professional counselors and Type 75 educational administrative certification from the state of Illinois. Matthew has since worked at Gateway, a substance abuse residential facility in Springfield, Illinois, as an assessment counselor. He then became a clinical counselor at Passavant Hospital in Jacksonville, Illinois. Once he completed his second master's degree, he was employed by the Central A&M School District as assistant principal at Kemmerer Village, their residential school in Assumption, Illinois. Finally, Matthew was employed at IDPH in October 2009 in the HIV section and recently has moved to the immunization section in November 2013. Please join me in welcoming Matt.
Good afternoon, everybody. There we go. I was waiting for the show my screen.
Yeah.
Okay. So I'm just going to speak specifically about the Remind Recall feature in iCare, which was alluded to in the previous presentation. Again, my disclosures, I have no relevant financial relationship with manufacturers of any commercial products or providers of any commercial services, and I'm not going to discuss any unimproved or investigative use of commercial product or devices in my presentation. Here's the vision and the mission of IDPH. These are slides we're required to give. And then here's our objectives for this afternoon. I'm going to talk about the patient list refresh, the patient remind recall functions in iCare, some new report features in iCare, and then who to contact when issues arise. Other iCare staff that we have, if you have questions, you could contact. Timothy Stevens is our public health administrator. We have Pearl Olatunji, which is an intern, and then Terry Nicholson is the iCare administrator. So first off, we're going to talk about the patient list refresh. And we highly recommend refreshing your patient list before using the Remind Recall function. Actually, we highly recommend refreshing your patient list before you run any large reports like coverage level reports, or if you're looking for specific patient populations and how they are documented in iCare, we recommend using the patient list refresh. The patient list refresh is under the Patients tab. Currently, it is only available for keymasters. If you don't know if you are a keymaster or not, when you log into iCare, you can see the Employees tab, as well as you can see the Patient List Refresh tab in iCare. If no one in your clinic has access to the Employees tab or the Patient Refresh List tab, then you'd want to contact us so we can nominate someone of your clinic. That function is actually going to go away, where everybody will eventually have access to the Patient List Refresh tab. And then you have specific selection criteria within the Patient List Refresh. You can either pick between patients who have received shots from your clinic in the past year, 3 years, 5 years, or 10 years, or you can pick just patients who were born between two specific dates. A nice feature about the Patient List Refresh is that you can view the changes before you apply them. So if you are looking for a specific population and you run this report, you can review it before you actually apply that to your population, so you don't have a lot of information that you weren't looking for. But once you apply them, the only way you can change it is, again, to rerun the entire report with different criteria. We do have some help into how to run this report. There's a link there, which is under the user manual in iCare. Also, there is a video in iCare on how to use the patient list refresh. So talking about the patient remind recall function. Providers can use iCare to create address labels. You can create form letters to send to the patients. You can use the form letters in multiple languages. English is the default language, but iCare will not translate into the forms. So if you want to have a form letter in Spanish, you would have to type it in Spanish. iCare will not translate it for you. We also have some generic English letters available in iCare for you to use, or you can customize your letters to have your letterhead, the doctor's name, location, actually anything that you want to customize and put onto the form letter. Remind recall notices may be generated as address labels, a patient list export, which would be an Excel file. You can create letters with the patient or parent's name at the top, or you can use postcards with just like reminders. You have an appointment coming up on such and such date, and on that date we expect you to get these vaccines, or your child is currently behind in these vaccines, please contact our facility. We also have some help for this. There's the Remind Recall video, as well as this link in the user manual that will give you step-by-step instructions on how to use the Remind Recall function. Some new reports that we have in iCare. The first one is the coverage level report. This is accessible under the Reports tab on the clinic page. This is a quick and easily accessible coverage report for both pediatric and adolescents that mirrors the NIS collection methodologies. This kind of replaces the COCASA reports that used to be in iCare, but currently they are only for pediatric and adolescents. So if you have an adult population, you wouldn't be able to run these reports as of now. There are going to be some customizable coverage level reports in the future where you can run these for specific age groups as well as vaccines. So you could run this coverage level report on patients who have received their first dose of HPV or all 3 doses of HPV. But it'll be customizable for you to choose. Again, there will be a video in iCare. There is one right now, but it needs to be updated, and that is coming probably by the beginning of this next year. So who to contact? So if you have questions about the functionality in iCare, like logging in, moving through the screens, new employees, new clinics, you would want to contact iCare. If you have questions about the physical vaccines, shipping, orders, waste, inventory issues, lost vaccines, you'd want to contact the VFC program. And if you're using an EMR and you're having questions regarding the data transmissions to iCare, there's the email for that. If you are having problems logging into iCare, there's the password support number or email address. And if you are using an EMR, they have their own passwords and they have their own password support. And there's my contact information. I did want to kind of show you a couple places in iCare so you could see where to find some of this information at. So here's our iCare homepage. On every page, down on the left-hand corner, we have these iCare shortcuts, and that's where you can find the user manual and the training videos. So anytime you have a question anywhere in iCare, you could go to either one of these and find some help. The user manual is text files, so they're step-by-step instructions. Well, obviously the training videos are videos when we'll show you screen by screen how to perform an act. And of course, all of the reports that I talked about are under the Reports tab. Here are your coverage level reports. Like I said, currently only the coverage level adolescent and childhood reports are active. But as you can see, we are creating other coverage level reports that will hopefully be available soon. And that's all I have.
Okay, thank you so much, Matt, for that presentation. We're gonna go ahead and enter into our question and answer session right now. And just to remind everyone that in order to enter in your questions, you would just go into the control panel that is on the right-hand side of your screen, click on questions, and then you'll enter that in and type and then hit send. So I do have one question so far, and that's can we get a copy of the PowerPoint presentations? And just to remind everyone that everyone gets the PowerPoint presentation as well as a link to view the recording of the webinar. Okay, another question is, are school nurses able to run the school physical report and see a completed school physical form?
Yes, in Illinois, school nurses are eligible to gain access to eye care, and then part of the legislation only allows school nurses to have the reports only function, which means that you can run reports including the school physical and the immunization record.
Okay. Are there any other questions at all from people? So I do want to remind everyone, while we're just waiting to see if anybody does have more questions, that everyone gets a copy of the PowerPoint slides, a link to the recording of the webinar, and also a link to an evaluation that you should fill out within the next 2 weeks in order to get CE credit. Let's just give it a couple more minutes to see if anybody has any additional questions. And in the time being, I just want to point out to people that on Tuesday, December 6th, we do have another webinar coming up, and that will be updates on the flu. Okay, so we do have another question. But daycare providers do not have access to a filled out physical form, ?
Daycare facilities, unless they have a full-time nurse, are not eligible for access to eye care.
Okay. And then another question is eye care connected to other states' vaccination reports?
No.
Okay. And when will eye care forecasting be updated for the new 2-dose HPV 9 series?
That I don't know. Should be shortly, and it may be today. That's when we update eye care is every Thursday afternoon. So I know that they've been working on it, but so hopefully today, but if not, soon.
Okay. And then another question is, has Illinois done any studies similar to Vermont?
Unknown. We haven't. Eye care, IDPH hasn't done any long-term studies. I know that we're currently involved with one with University of North Carolina on HPV, but I don't think those results have been published yet.
Okay, and following up on that, will eye care ever release similar coverage level maps like Vermont?
I imagine so. Mm-hmm.
Okay.
I imagine we will. Sorry.
No, that's fine. And then how many CEUs for these webinars do nurses receive? So it'll be 1 credit for physicians and nurses. Okay.
And this is Bridget. I just want to weigh in for 1 second to say that immunization registries everywhere appreciate knowing what kind of information providers want to hear, because we build systems to help you. And so if you have ideas like that, I would encourage you to talk with immunization registry staff in your state or in your city.
Mm-hmm. Thank you for that. That's definitely really, helpful information, because it's always interesting to see what type of information, providers want to be able to access and see. But of course, if nobody's sharing that, then we wouldn't be able to know. So this is a CME question, but it's will CME credit be automatically recorded in my Pedia link? And, to be honest, I am not really sure about that question. The main thing is that we do give a certificate afterwards that if you get audited, then you would be able to show that. So I can't answer that one to 100% accuracy, unfortunately. So it doesn't look like we have any more questions at all. So, oh wait, there is one more about, do all physicians have to put immunizations into eye care?
Currently, only providers who are part of the Vaccines for Children or VFC program are required to put immunizations in eye care. And then they're only mandated to put in the VFC vaccine. So if they have adult patients or non-VFC patients, they're not required to put those into eye care. We wish we were like Vermont and we could mandate all providers to document all vaccines in eye care, but we're not there yet.
Okay, thank you, Matt. So, okay, so
But I guess I'd like to add a little bit to that. We would highly recommend that all providers who provide vaccines to all populations, children, adolescents, and adults, to sign up for eye care and send those immunizations to us so that we can have more of a comprehensive immunization registry, which is what our name is.
It's especially true right now where people are getting immunizations in lots of different places. We have people getting shots in nursing homes and people getting shots in pharmacies. And you're really saving money if you have one central place where any provider can go and look up a patient and see, did they already have that flu shot? Did they already have that pneumo shot? So we have really seen that it's a valuable tool in our state. And I'm just a big proponent of registries, as you can tell.
Another question is, are all physicians aware of the importance of that?
Well, we've been beating the bushes since 2010, and going around the state providing presentations in multiple locations from Rockford down to southern tip of Illinois. Letting people know about it. But if you aren't part of the VFC program, or your primary population isn't children and adolescents, maybe those physicians aren't attending those seminars because they don't feel that it is of a value to them.
Okay, so I'm going to go ahead and wrap the webinar up then. So I just want to review a couple closing points really quickly. Kelly wants to know, how can we find out about future eye care trainings? So we actually do have another webinar about eye care coming up in December, and then throughout the year we have about 6 regional trainings that take place all over Illinois, and we always include an eye care training about that. Unfortunately, we've concluded our regional trainings. This year we've already done all 6 of them. The last one was actually just last week, but we'll of course be offering them again next year, and everyone will be receiving information about that information. So just be on the lookout for all these emails that advertise all of our events, and you should be able to get all of your training needs through that. So just to quickly go ahead and wrap up the webinar, everyone is going to be receiving a copy of the PowerPoint slides, a link to complete the webinar, and a link to the recording of the webinar by either the end of business day or sometime tomorrow. Everyone needs to complete the evaluation by November 4th. After that date, the evaluation will be closed and you will no longer be allowed to fill out the evaluation or receive a certificate of attendance and or continuing education credit. Everyone should receive their certificate sometime around November 30th, 2016. So this wraps up our eye care webinar. I just wanted to thank everyone so much for attending as usual, and thank you to Bridget and Matt for that excellent presentation. And we look forward to seeing you guys soon at any of our remaining 2 webinars in the year. Thank you so much and have a great afternoon, everyone.